About a year and a half ago, our friend Andrea sat in an emergency room struggling to make decisions on behalf of her Uncle Frank. Frank was unconscious and unable to speak for himself. Frank's journey had actually begun 6 months prior when he was diagnosed with throat cancer. Before that night, he'd undergone surgery, received treatment for an infection, and spent time at a skilled nursing facility. But despite these different touch points in the health system, Frank's doctors never told him how to talk to Andrea about what to do if he couldn't speak for himself. So where did that leave Andrea? That night, the doctors turned to her and asked if they could put in what's called a central line. Andrea sat there with her uncle's do not resuscitate paperwork in her hand, the doctor's question on her mind, and she said, "I don't know. I'm not sure what he would want." That night, Andrea had to answer the question, but it very well could have been anyone in this room. So now my question to you is, if this were your loved one, would you know what to do? 40% of patients who are hospitalized, like Frank, need a medical proxy or a decision maker like Andrea to speak on their behalf. Having a written plan in place can help proxies and care teams ensure that patients receive the care they want. But in the US, 63% of adults don't have an advanced care plan in place. That means 250 million people have not identified or documented their end-of-life healthcare wishes. There are some factors that lead to barriers to advanced care planning. It's a tough conversation to have. People don't know how to have it, and so delay the process of advanced care planning until it's too late. Hospitals, on their end, are facing a shortage of trained staff who are trained to help patients navigate these conversations. So often if somebody gets to the point of having an end-of-life conversation, it often happens in a lawyer's office as part of a trust and estates process. That person leaves with a written document, goes home, tucks it away in a safe place. But when an emergency arises, that document is not accessible. Canopy is using technology to turn this problem around. We believe that you have the right to receive respect, dignity, and have choices throughout your life. So we're leveraging technology to help people uphold these key values as they navigate healthcare in particular. We do this by providing a web application that supports people like Frank and Andrea in 3 key ways. Let me tell you how their story goes with Canopy. Frank receives education on what advanced care planning is, what it entails, and how to do it. Canopy's audio coach walks Frank step by step through a process of clarifying his end-of-life healthcare wishes and documenting them into an advanced care directive. Frank then shares his legal documentation with Andrea as well as with his care team. Not only do they get his advanced directive, but they also get a complete profile that includes video and audio recording of Frank sharing his wishes in his own words. Canopy's digital solution provides value across the healthcare ecosystem, bringing together key stakeholders around what that patient wants. When an individual's wishes are known, patients and families experience greater peace of mind. Doctors are able to provide specific care that the patient wants, helping to avoid unwanted care or unwanted extensions of care. As a result, advanced care planning is shown to cut the cost of end-of-life healthcare by 50%. End-of-life conversations become increasingly important as more people are entering their retirement age. 5 years from now, there will be 82 million individuals in the US over the age of 55 and without an advanced care directive. This amounts to a $4.1 billion opportunity. Canopy will reach this market by providing an enterprise solution, with our first customers being hospitals. Hospitals face a pressing need for advanced care planning, and with our product, we'll be able to hit key metrics while taking advantage of existing billing codes. So we provide the enterprise solution to the hospital, who then passes along our consumer-facing tool to their patient. The patient's documentation is sent to Canopy's central repository, and is also shared with the health system. Canopy charges the health system a licensing fee that ranges from $1,000 to $10,000, depending on the size of the system. And we also charge a $50 fee per patient who uses the product. In the short term, we're launching a direct-to-consumer strategy as we land our first hospital. As we move beyond hospitals, we'll be selling to health insurers, large employers, as well as channel partners who work with our target population. Canopy is not alone in this space, but health systems are still searching for solutions. The market is massive, and our competitors have not yet saturated this market. Canopy is positioned to excel because we're providing 3 key factors that are necessary for successful advanced care planning: education, step-by-step support along the way, as well as information sharing, so the right people have the answers they need when they need them. Our journey began last year while we were graduate students, and since then, we've raised about $90,000. We'll be launching a private pilot of our product this fall, and early next year are raising a seed round to help us land our first customers as well as scale our business. While at Desai, we've been honing in on our first customer, and over the past several weeks have had conversations with different entities interested in our product. Canopy has an incredible, incredible team working to make our vision a reality. As CEO, I bring my understanding of health behavior to the work that we do, as well as experience working with different stakeholders in public health to sell our product. Anne brings her knowledge of web development and data analytics to develop our software. And without Brandon's understanding of human-centered design, our product would not be where it is today. What we are asking of you today are connections to angels, connections to healthcare organizations, but I hope you're listening closely. Most importantly, sign up on our website and participate in our private beta, because the work that we're doing is a community effort. At Canopy, we're putting humanity first. We're guiding people towards a process of achieving what probably all of us in this room want: respect and dignity throughout the lifespan, but particularly during life's most vulnerable moments. With Canopy, people like Frank, Andrea, and the care teams who work with them will have everything they need today to better manage the difficulties of tomorrow. Thank you.